Imagine waking up one morning feeling unusually tired. You slept through the night, you ate breakfast, you even had your morning coffee, but somehow you still feel exhausted. A few weeks later, you notice something else. Your feet start tingling. Walking across the room doesn't feel quite as steady as it used to. Then you begin forgetting little things. Where you left your keys, the name of someone you've known for years. You tell yourself, I'm just getting older. But what if it isn't simply aging? What if your body is quietly trying to warn you that it's missing one essential nutrient? One that millions of adults over the age of 60 don't get enough of. Today, we're talking about vitamin B12 deficiency, a health issue that's surprisingly common among older adults, yet often overlooked because its symptoms develop slowly over months or even years. The good news? In many cases, recognizing the warning signs early and getting evaluated can help prevent further problems and, depending on the cause, treatment may improve symptoms. And here's something many people don't realize. Some of the most common symptoms don't begin in your stomach. They begin in your brain. Others start in your nerves. And one of the warning signs we'll discuss later is often mistaken for early dementia. So make sure you stay until the end, because the final warning sign is one that doctors say should never be ignored. Let's begin. Why vitamin B12 matters after 60. Before we talk about the warning signs, let's first understand why vitamin B12 is so important. Think of vitamin B12 as one of your body's maintenance workers. Every single day, it helps your body perform several critical jobs. It helps make healthy red blood cells. It supports healthy nerve function. It plays an important role in making DNA, the blueprint inside every cell. And it helps your brain function properly. Without enough vitamin B12, these important systems begin slowing down. The challenge is that this doesn't happen overnight. Unlike some vitamin deficiencies that cause noticeable symptoms quickly, vitamin B12 deficiency usually develops gradually. At first, you may feel perfectly normal. Then, over time, small symptoms begin appearing. You may blame them on getting older, or stress, or poor sleep. That's exactly why so many people live with low vitamin B12 for months, or even years, before discovering the real cause. Another reason this deficiency becomes more common after age 60 is that our bodies naturally become less efficient at absorbing vitamin B12 from food as we age. Certain medications and medical conditions can also make absorption more difficult. That's why healthcare professionals often pay close attention to vitamin B12 levels in older adults who develop unexplained symptoms. Now, let's look at the warning signs. Warning sign number 1. Constant fatigue that doesn't improve with rest. Have you ever had one of those days where you felt completely drained, even though you hadn't done very much? Now, imagine feeling that way nearly every day. That's one of the earliest symptoms many people with vitamin B12 deficiency describe. This isn't the normal tiredness that comes after mowing the lawn or chasing after grandchildren. It's a deeper kind of fatigue. Some people say they feel like their energy tank never fills up. Why does this happen? Vitamin B12 helps your body produce healthy red blood cells. These cells carry oxygen throughout your body. When you don't have enough healthy red blood cells, your muscles, organs, and brain may receive less oxygen than they need. As a result, simple daily activities can suddenly feel exhausting. Walking upstairs, shopping for groceries, cooking dinner, even taking a short walk around the neighborhood may leave you unusually tired. Many seniors simply assume, well, I'm getting older. But persistent fatigue should never be ignored, especially if it appears alongside other symptoms we'll discuss today. Of course, fatigue has many possible causes: poor sleep, heart disease, thyroid problems, depression, medication side effects, and many other medical conditions can also make you feel tired. That's why it's important not to diagnose yourself based on one symptom alone. Instead, think of today's video as helping you recognize patterns you can discuss with your healthcare provider. Quick question: Have you felt more tired over the past year than you used to? Let us know in the comments below. Many viewers find it helpful to hear they're not alone. And if you're finding this information useful so far, consider subscribing. Every week we share simple, evidence-based health information designed specifically for adults over 60. Now let's move on to another warning sign that often appears together with fatigue. Warning sign number 2. Tingling or numbness in your hands and feet. Imagine wearing thick socks, even when you're barefoot, or feeling tiny pins and needles in your fingertips. Some people describe it as a buzzing sensation. Others say their feet simply don't feel quite right anymore. This happens because vitamin B12 plays an important role in keeping your nerves healthy. Your nerves are covered by a protective layer called myelin. Think of myelin like the insulation around electrical wires in your home. When that insulation becomes damaged, signals traveling through the nerves become slower and less reliable. As a result, you may notice tingling in your feet, numb fingertips, burning sensations, reduced feeling in your toes, difficulty noticing hot or cold temperatures. Many people first notice these sensations at night while lying in bed. Others notice them when walking barefoot across the floor. Over time, nerve problems can also affect balance, making falls more likely if the underlying cause isn't addressed. That's one reason healthcare providers take these symptoms seriously, especially in older adults. The important thing to remember is that nerve symptoms can also have many other causes. Diabetes is one of the most common. Circulation problems, spinal conditions, certain medications, and other vitamin deficiencies can also contribute. But vitamin B12 deficiency is one possible cause that should be considered, particularly when tingling appears together with fatigue or other symptoms from today's list. Now here's where things become especially interesting. The next warning sign doesn't affect your muscles. It doesn't affect your stomach. Instead, it affects something far more personal, your memory. And it's one of the reasons vitamin B12 deficiency is sometimes mistaken for normal aging in its early stages. Warning sign number 3. Memory problems and difficulty concentrating. Have you ever walked into a room only to completely forget why you went there? Or struggled to remember a familiar name? Occasionally forgetting small things happens to everyone. Stress, poor sleep, certain medications, and even dehydration can temporarily affect memory. But when memory problems become more frequent or are accompanied by other symptoms, it's worth discussing with your healthcare provider. Vitamin B12 helps keep the brain and nervous system functioning properly. When levels become too low, communication between brain cells may not work as efficiently. Some people describe it as feeling like there's a brain fog. They know what they want to say, but the words don't come as quickly. Others notice difficulty concentrating, trouble following conversations, forgetting appointments, losing track of everyday items, feeling mentally slower than usual. These changes often develop so gradually that family members may notice them before the individual does. One daughter shared that her father started asking the same questions several times during family dinners. Everyone assumed it was simply part of getting older. After speaking with his doctor and being evaluated, they discovered one contributing factor was low vitamin B12. The important lesson isn't that every memory problem means vitamin B12 deficiency. Far from it. Memory changes can have many causes, including medication side effects, depression, thyroid disease, sleep disorders, and neurodegenerative conditions. But vitamin B12 deficiency is one treatable cause that healthcare providers often consider because identifying it early may help prevent further nerve damage. That's why ignoring persistent symptoms is never a good idea. Has anyone in your family ever been diagnosed with low vitamin B12? Or has your doctor ever checked your vitamin B12 level? Let us know in the comments. Your experience may help someone else realize they're not alone. Warning sign number 4, feeling unsteady or losing your balance. Here's something that surprises many people. Balance doesn't depend only on your muscles. It also depends on healthy nerves. Every step you take requires your brain and nerves to communicate instantly. Your feet tell your brain where the ground is. Your brain tells your legs how to respond. When those signals become disrupted, even slightly, balance can become less reliable. Some seniors notice they begin holding on to furniture more often. Others feel less confident walking downstairs. Some avoid walking outdoors because they worry about falling. Family members sometimes hear phrases like, "I just don't feel steady anymore." This symptom deserves attention because falls are one of the leading causes of injury among older adults. According to the Centers for Disease Control and Prevention, millions of adults over 65 experience falls each year, and many result in serious injuries. Vitamin B12 deficiency is only one possible contributor to balance problems. Vision changes, inner ear disorders, arthritis, stroke, Parkinson's disease, certain medications, and muscle weakness can all affect balance as well. But if balance problems occur together with numbness, tingling, or unusual fatigue, your healthcare provider may decide that checking vitamin B12 levels is appropriate. Never ignore sudden balance problems. If you experience a sudden loss of balance, weakness on one side of the body, slurred speech, or severe dizziness, seek emergency medical care immediately, because these could be signs of a stroke. We've talked about your energy, your nerves, your memory, and your balance. Now let's discuss a warning sign that's hiding in plain sight. It's visible every time you look in the mirror. Warning sign number 5. A pale tongue, mouth soreness, or changes in taste. Most people never think to check their tongue, but sometimes it can provide clues about what's happening inside the body. Some individuals with vitamin B12 deficiency develop a tongue that looks unusually smooth, shiny, or bright red. Others notice mouth soreness, a burning sensation on the tongue, changes in taste, reduced appetite, small mouth ulcers. Eating spicy foods may suddenly become uncomfortable. Even brushing your teeth might feel more painful than usual. These symptoms happen because vitamin B12 helps maintain healthy cells that line the mouth and digestive tract. Without enough vitamin B12, those tissues may not repair themselves as efficiently. Again, these symptoms are not unique to vitamin B12 deficiency. Iron deficiency, certain infections, dry mouth, medication side effects, and other medical conditions can produce similar changes. That's why healthcare professionals look at the complete picture rather than one symptom by itself. Practical tip. If you've noticed several symptoms from today's video, not just one, it may be helpful to write them down before your next medical appointment. Many people forget important details once they're sitting in the exam room. A simple notebook or note on your phone can help you remember when symptoms started, whether they've become worse, any new medications, changes in diet, recent illnesses. These details can help your healthcare provider determine which tests, if any, may be appropriate. We've now covered 5 warning signs, but the final 2 are among the most important. One may affect your mood in ways you never expected. The other can signal that your body isn't making enough healthy red blood cells. We'll also answer one of the most common questions seniors ask. How can I naturally get enough vitamin B12 after age 60? And the answer may surprise you, because it's not simply about eating more meat. Warning sign number 6. Mood changes, irritability, or feeling down. When most people think about vitamin B12, they think about energy. Few realize that it also plays an important role in keeping the brain and nervous system healthy. Because of this, some people with vitamin B12 deficiency notice changes that aren't physical at all. Instead, they affect emotions. Some individuals report feeling unusually irritable. Others lose interest in hobbies they once enjoyed. Some describe feeling anxious or emotionally flat. Family members may notice that their loved one seems quieter than usual or gets frustrated more easily over small things. Of course, mood changes become more common for many reasons as we grow older. Retirement, losing loved ones, chronic pain, poor sleep, loneliness, medication side effects, and depression can all contribute. Vitamin B12 deficiency is simply one possible factor that healthcare providers may evaluate, particularly when mood changes occur alongside other symptoms such as fatigue, numbness, or memory problems. If you or someone you care about experiences persistent sadness, anxiety, or significant mood changes, don't ignore them. Mental health is just as important as physical health, and it's always worth discussing these symptoms with a healthcare professional. One retired gentleman shared that he had stopped attending his weekly breakfast with friends. He assumed he was simply getting older and slowing down. But after talking with his physician, several possible contributing factors, including low vitamin B12, were evaluated. His story is a reminder that sometimes what feels like just aging deserves a closer look. Warning sign number 7: pale skin, shortness of breath, or feeling weak. Our final warning sign relates to your body's ability to carry oxygen. Vitamin B12 is essential for making healthy red blood cells. Without enough vitamin B12, some people develop a type of anemia called megaloblastic anemia, where the body produces fewer healthy red blood cells than it needs. As a result, less oxygen reaches your muscles and organs. You might notice looking paler than usual, becoming short of breath after mild activity, feeling unusually weak, feeling lightheaded when standing up, a racing heartbeat during everyday tasks. Maybe climbing one flight of stairs suddenly feels much harder than it used to. Or perhaps walking across a parking lot leaves you more winded than expected. Again, these symptoms have many possible causes: heart disease, lung disease, iron deficiency, dehydration, and many other conditions can also cause similar symptoms. But together with the other warning signs we've discussed today, they may give your healthcare provider important clues during an evaluation. Who is more likely to develop vitamin B12 deficiency? You may be wondering, who should pay extra attention? Several groups are at higher risk, including adults over 60. As we age, the stomach often produces less acid, making it harder to absorb vitamin B12 naturally from food. People taking certain medications. Long-term use of medications such as metformin for diabetes or proton pump inhibitors, PPIs, for acid reflux can reduce vitamin B12 absorption in some people. Never stop taking prescribed medication on your own. If you're concerned, discuss it with your healthcare provider. People following vegetarian or vegan diets. Vitamin B12 is naturally found mainly in animal-based foods. People who avoid these foods may need fortified foods or supplements, depending on their healthcare provider's recommendations. Certain digestive conditions. Conditions affecting the stomach or intestines, such as pernicious anemia, Crohn's disease, or previous stomach surgery, can also interfere with vitamin B12 absorption. Foods rich in vitamin B12. If your healthcare provider says your vitamin B12 levels are normal, maintaining a balanced diet can help support healthy levels. Foods naturally rich in vitamin B12 include salmon, trout, tuna, lean beef, eggs, milk, yogurt, cheese, chicken, fortified breakfast cereals. If you're vegetarian or vegan, look for foods specifically fortified with vitamin B12. However, for some older adults, the issue isn't getting enough vitamin B12 in the diet, it's absorbing it. That's why simply eating more vitamin B12-rich foods may not correct a deficiency if your body isn't absorbing it properly. Only your healthcare provider can determine the underlying cause and recommend the most appropriate treatment, which may include dietary changes, oral supplements, or injections, depending on your individual situation. Should you take vitamin B12 supplements? This is one of the most common questions seniors ask. The answer is, it depends. Vitamin B12 supplements can be very helpful for people who truly need them, but not everyone needs to take one. Too often, people start supplements based on something they saw online without knowing whether they actually have a deficiency. A simple blood test, combined with your symptoms and medical history, helps your healthcare provider determine whether supplementation is appropriate. If your doctor recommends vitamin B12 supplements, follow the dosage and schedule they advise. Avoid assuming that more is always better. Quick recap. Let's review today's 7 warning signs. If you've noticed several of these together, it's worth discussing them with your healthcare provider. Checkmark. Constant fatigue. Checkmark. Tingling or numbness. Checkmark. Memory problems or brain fog. Checkmark. Poor balance. Checkmark. Mouth or tongue changes. Checkmark. Mood changes. Checkmark. Pale skin or shortness of breath. Remember, these symptoms do not automatically mean you have a vitamin B12 deficiency. They simply mean it's worth having a conversation with your healthcare provider, especially if symptoms are new, persistent, or getting worse. Growing older doesn't mean you should simply accept feeling tired, forgetful, or unsteady. Many changes are a normal part of aging, but some symptoms deserve attention because they may have treatable causes. Listening to your body, staying active, eating a balanced diet, keeping up with regular medical checkups, and speaking up when something doesn't feel right are all important parts of healthy aging. The earlier a problem is identified, the better the chance of managing it effectively. If you found today's video helpful, please give it a thumbs up. It helps us reach more seniors who may benefit from this information. Subscribe to Healthy Scenes for weekly videos about healthy aging, nutrition, heart health, brain health, mobility, and practical wellness tips designed especially for adults over 60. And before you go, tell us in the comments, which of these warning signs surprised you the most? We read every comment, and your experiences may help someone else realize they're not alone. Thank you for watching, and we'll see you in the next video.